Hi everyone, my name is Brittney Kidd. The health topic I chose for my presentation is trauma. Today I will discuss the history of trauma, the different ways it can impact a person, prevention, and also different treatment strategies for the condition. Trauma is defined as the way our bodies respond to stress and life-threatening triggers. The response can be socially, it can be emotionally, or it can also be psychologically. There are three different types of trauma a person can experience. You can experience an acute trauma, which means that only happened one time. You can experience chronic trauma, which means you have had repeated exposure to that trauma. And then you also have complex trauma, where you've had multiple different traumas or you have experienced long term traumatic events. Over 70% of adults have experienced some type of trauma in their lifetime, according to the World. Trauma was first discovered in the early 1900s during World War One, and it was referred to as shell shock in reference to the soldiers. Now, as time has trauma is also known to be caused from abuse, accidents, and also systemic violence. Trauma informed care now includes approaches that acknowledge how widespread this condition is, how it can affect a person's health in the future, and also how to treat this so that we can avoid future traumas in the future. First way trauma can impact a person is biologically. Stressors send signals to the hypothalamic pituitary adrenal, which is also known as the HPA axis, which causes cortisone levels to increase. Cortisol raises your blood sugar, and if that is increased for long periods of time, it can weaken memories that rely on certain parts of your brain. And while it weakens those memories, cortisol can strengthen the memories of fear that rely on the amygdala section of your brain. So you will definitely, or your brain or your body will respond to things that remind you of being scared in those traumatic situations, but you won't remember the trauma, or not the trauma, but the events that you actually went through outside of that. And to me, that's kind of explained. It's kind of like having trust issues, which kind of could be minimal, but they can go very deep as well. It can be very severe to a person psychologically and socially, but you can develop PTSD, depression, anxiety, and people who suffer from trauma are also known to suffer from substance abuse as well. Trauma does not just affect the person that it is happening to, it continues through generations of families and communities, and it affects behaviors, relationships, parenting styles, and these are things that will continue again and again, and that's what causes that intergenerational trauma. Of course, trauma isn't something we can completely prevent. We can't prevent traumatic experiences from happening. Recovering from trauma is more so about learning how to deal with and kind of retrain your body to deal with those traumatic experiences when they do happen. Preventative measures include creating programs that have strong social support so people feel like they have someone to go to. You can have adults who are at risk for trauma get early screenings and interventions, such as those who have had parents that they know have went through trauma, or grandparents that they see have went through trauma, or myself, my great grandma who I grew up with, her grandma was a slave. So that is something important to know about your family if you're able to, and it can really explain the reason why they act a certain way or the way they talk to you, the chores they have you do, the way they clean, the way they feel about, just so many things. But like I said, recovery from trauma is very possible. And again, it doesn't include the trauma going away, or it's not something that will happen, but it allows us to help ourselves get through these things when they are happening and create that safe place within ourselves. And a good idea to help with that is finding ways and methods to help you realign with your body and create that sense of safety within yourself. A lot of people use things such as yoga and working out, working on relationships with, their religion. Everyone has different processes. Treatments such as EMDR, talk therapy, and cognitive behavior therapy have also had have also been known to be very effective as well. In conclusion, trauma is a very complex health condition. It has deep biological impacts, it has deep psychological impacts, and also deep social impacts. With great awareness, early treatment, support, and recovery, gaining that safety again within yourself is absolutely achievable.